Hey everybody, this is Dr. Jiveh and welcome to the Smiles by Jiveh Experience podcast. So we have a very special guest today, which we're gonna get to know today. And can you go ahead and introduce yourself? We have Gabriel Hofmann. Tell us who you are, what you do, and would love to know more about you because I know a little bit about you, but I'd love to hear it from yourself.
Sure, sure. Thank you for having me, Dr. Jiveh. I'm excited to talk to you today. Again, as you said, my name is Gabriel Hofmann. My friends call me Gabe. I have the pleasure of working with large practices and groups to take their biggest challenges, log jams, uh, slowdowns in their business, and turn those pains into profit with sustainable solutions in one of my businesses. I have another entity where we provide technology and equipment, which are solutions that either improve the efficiency of patient care or the delivery of patient care. And ultimately, both those entities are on a high level really focused on bringing some joy into areas of the practice where they may be challenging or pains or inefficiencies now.
Oh, I
So
totally get that. I totally get that because we have, as dentists, we have some challenging days, and it's how you not only how to combat your challenges, not only how to react to challenging situations, it's also having the tools. And I guess that's where you come in. I'm gonna digress just a little bit. Tell me a little bit about your personal self. Who are you? What do
yeah,
you
sure. Sure. And you had asked a question previously, so I'll also add a little bit of detail on
sure.
my background, who I am, how I got to today. But yeah, so I'm happily married. My wife, Erica, we have three amazing children. We are a blended American family. So we have one 22, almost 23-year-old who is in Misawa, Japan, named Shay. She's a senior at University of Maryland. She was a child in college in COVID, so she had a delayed year before she decided to move to Japan and go back to school.
Wow.
Um, I have a 19-year-old son named Ethan, who is also a very good child. Amazingly, my all three of my kids are great. Surprising to me on certain days, but my middle son Ethan, he's in two trade schools right now. He decided to go that route. He's doing really well there and has a business in e-commerce that is a passion of his. So I love to see that in my 19-year-old. And then we have a 7.5-year-old who is uh, he keeps us hopping. He's in two sports, both travel basketball and travel soccer at 7.5, and he is a ball of
Travel.
energy.
Oh
Yeah.
my
So
God.
so we are busy
Yeah.
with our youngest, but he keeps us on toes, and it's fun. You have to be creative with a young child in the house, whereas teenagers, they're more independent. So
Yeah.
yeah,
Yeah.
that's who I am personally.
That's also
They
that's
are.
okay. Sorry, go ahead. Go ahead.
I was just gonna say they are why I do what I do, and I have the two businesses now, but my career started in practice operations many years ago. I spent about almost 2 decades in practice operations in from large DSO to uh, some call it emerging groups, and then did some private consulting and had the opportunity to develop a group with partners of 6 multi-specialty locations in the greater Philadelphia area with removable labs. And through that process, I got to wear just about every possible hat there was in building a de novo group. And so that was a fabulous learning opportunity. But after doing that for about 5.5 years, my wife and I realized we were having our youngest. And so I moved back home and led a national equipment and technology distribution company for
Mm,
dental with limited medical modalities. So as of last year, I pursued a passion that I had started in 2014, which is working with offices to help them grow and develop their practice. And like I said, turn those challenges into ultimately net profit and EBITDA for them, so that they can grow their business and really empower team accountability. And so that is why I went out on my own, and now have a couple team members that help me in this journey, and brings me to today talking to you, Dr. Jiveh.
So, okay, so really quick, I'm gonna get Oprah on you here. I want to know about you. I mean, if you had one word, one characteristics, for example, I want to know, who are you? What do you resonate with? What do you get out of life? Like, what's your character? What's your best character that people should know? Is it like, for example, is it you're passionate about your work, your kindness, your what is it about you yourself personally, your inside, that you find to be your best asset?
My that fire in me is helping people and helping people to help people, right? That's really what drives me. At the end of the day, it's all about helping people to improve where they are, how they feel, or their day workflow. That is really, on a high level, why I love to do what I do.
And how does that make you feel when you do that? When you, for example, when you go to an office, you elevate their office and you see them getting more joyous. How does that make you feel?
That's, the joy is the byproduct of eliminating, right? Like that is the goal,
That's what
right?
it's
And
about.
and taking those, right, it's going to improve everybody's lives, right? it's
Yeah,
gonna it's gonna grow the practice. It's gonna improve the doctor's happiness, the team members, the culture. The team members are going to be happier, right? And that, all of that becomes a symbiotic culture that is, again, accountability is no longer a hierarchy. It's We're always providing feedback because we're all focused on helping each other
yeah,
grow for an aligned purpose, right? That's what happens when you eliminate those day-to-day struggles and are able to focus back on what you do best, which is your passion, right?
that's awesome. That's awesome because I was listening to a podcast. We were talking about that. I was listening to a podcast. It said, if you want to be more prosperous, go and make others prosperous. And it's a continuous work of service, and it's a continuous, that joyous feeling that you will, it's never ending. And it's like an alternator when it charges a battery. Both things are charging and both things are going at the same time. So that's awesome, man. That's great. um so I want to know, what got you into this. And tell us
Yeah.
more detail of what exactly it is, and what got you into it.
I yeah, I can tell, years ago, right, when I was in operations, in all different size groups, the largest DSOs to my private group, I realized the patterns, right? The consistent challenges, the things that impeded the ability to really focus on the greater good on a day in and day out basis. There's so much good that happens in dental practices.
Mhm.
Um, a lot of times those challenges get in the way of gratitude and finding the silver lining in the team that we work with, or the patients that we treat, or the care that we're providing, that again improves their lives. I have had the fortune of working on a personal side, being involved in a couple charity organizations in my free time that help men uh, become, the best versions of themselves physically, relationally, spiritually, and mentally.
Mm.
And so that helped to hearken that passion, right? It just reinforced that fire to help people improve where they are right now, right? And all those obstacles that are in the way of their growth. Let's There are solutions for those. So let's get them out of the way so we can set new destinations.
Yeah. That's great, man. That's great because when you talk about people doing self-improvement, there's a quote by Jim Rohn. He says, "The single greatest gift you can give others around you is to become your best version." And it is
I like that.
so true, man. And you, it's crazy. And I'm digressing because of what you said. It's great, crazy because when you become your best version, you become a pathway for others to heal by being an example, by being an exemplar to them. So bring up a great point. So tell me some of the challenges of what you do.
Sure. Like being a dual entrepreneur with a lot of new projects and both lateral and some horizontal and vertical growth opportunities right now. There's a lot of moving pieces, and working. I I've been known by peers as the dental efficiency guy, and in that it was very obvious to me the inefficiencies that I have in my day and my business, or businesses, I should
Mhm.
say, and so challenges, right? It's managing resources. Uh, uh, Being an entrepreneur, no matter the size of your company, there are days that can feel kind of lonely when you're working on certain things. And so it's important to have that circle of trust and continue networking with individuals. And there's a great book, Who Not How, that I go back to. Two books that I have read many times that help me to refocus. One is Who Not How by Dan Sullivan. The other is Crucial Conversations: The Rules for Talking When Stakes Are High. There are
Mm.
so many great quotes in that have hung with me over the years, that really just take back those challenging positions, those difficult situations that we put chains. We have chains here. We put up borders, issues in our mind. It inhibits us from moving forward or advancing where we are. That book is fantastic for,
Yeah.
moving through those challenges.
Yeah. And then there's another quote that I'll honestly that stayed with me because people don't know this. Your the quote it goes like, your biggest weakness is the fact that you don't know how powerful you are until you're faced with the situation and your inner power just comes out. So that's great. So what if somebody wants to work with you? I mean,
Sure,
how do they do
sure.
that?
So I'm on all the social channels. I have two websites, Activise and Geceg Surgical. I am happy to share a short questionnaire, which is a Google form that if a doctor fills that out with their personal information, we can have a 15-minute call
Mhm.
where I can share more about what I do, but ultimately learn more about uh, their practice, that person, and their goals, and see if it makes sense for us to take a deeper dive. So yeah, I am more than happy to do that. And the more people that I can connect with on a daily basis, the more opportunity we have to, for the greater good. So I'm all about it, and I thank you. You always provide so much insight, Dr. Gervais, on the inner well-being and spiritual growth, and have provided me amazing quotes over the years that also or over, I guess, the months, I should
Right.
say. It's
No,
such
I
a such
appreciate that. It,
uh
it, it's funny you say that. I just came back from a retreat last weekend. It was called Awaken. And holy cow, you think you know some things about yourselves, and there's so much in the mind that you don't know, and so much potential we all have to help others. It's 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 limitless. It's limitless what we can do. Everything we want is there. We just have to have the right mindset. And that's
So true.
so important to people to see that it's all there. And a lot of times, we allow fear and we allow ego to get into our hearts. And I talk about that in my other podcast is the heart is the only place that love exists should be in the heart and nothing else. And our mind tries to sabotage that all the time, just to put fear in there. What if this, what if that? um I think Nike has the single greatest slogan ever created in the
Just do it.
history of humanity: just do it. If you have the intuition, if you have the right mindset, if you know this is going to bring positive, incredible stuff to people, no hesitation, and get that fear out of your heart, and get that doubt out of your heart, get that ego out of your heart. But that's good stuff, man. Lastly, I want to know one example, if you can tell us one
Sure.
example of how. I want to know how, yes, the technology is there, we help people. I want to know how people changed, how the mindset changed, how the feelings changed with your assistance to an office, for example.
Sure. So I'll walk through a solution and the
Hmm.
example with that solution, and it should provide clarity on that. So many times an office has some out of date technology. Let's take imaging, for instance, right? We use images each and every day to not only diagnose, but to treat patients, recall. Uh, that is an extremely important tool in the practice, right?
Hmm.
And
Hmm.
so often we're so busy working in the business, do we stop and look at, are we getting the right image in a busy office that not only is comprehensively diagnostic, but are we doing right by the patient because we can provide the right diagnosis? Are we mitigating our risk and protecting our license? Right? Are we most efficient with our time? Because now, if we have the right image, which the right image is the most diagnostic image to see everything that you need to see, if that's the case, right, and we stop taking the status quo, walking into a room and seeing that, hey, we have this blurry image, but we're going to go ahead and do the exam as opposed to sending the patient back, then we're doing right by the patient, we're doing right by the practice, and the opportunity cost is mitigated because now we're going to have more treatment and the right seen and able to diagnose what we need to be.
Yeah.
So
Yeah.
I walk through that example because when that happens, right, it's a simple thing that we may be too focused on. Maybe it's the cost, maybe it's learning a new technology, maybe it is complacency or comfort with what we have. And
Hmm.
there's not necessarily anything wrong with that because that's human nature. However, what that's doing to you and your workflow is limiting your ability to continue, right? Complacency is really taking two steps backwards. So we're able to redirect to a growth mindset, and again, it's more joyous because now we don't have the patient satisfaction issues to deal with when a patient is coming in and we're not able to diagnose the first, second, or third visit, but when we get the right image, maybe on the fourth visit. Again,
Hmm.
just using that same example, our team member, there's no drama there because they know they have to get the right image before they bring that patient back to the room. You're able to provide comprehensive diagnosis. So your average per patient treatment presentation, treatment acceptance goes up, right? It's a win-win-win, right?
Right.
So that simple change has ripples, right, for
And
sustainable growth.
yeah.
And
Yeah.
so that is really why I smile about that, because it's a little thing that when you make that change, it can it can make an enormous change on the trajectory of your team and your practice and
And
uh and
so
and
many
your
people.
life.
Yeah. Yeah. So many people. I love that, man. Well, you know, the service you provide, it goes without saying. But your authenticity and your passion, man, it just shines through. And I appreciate the time and the information. And I'll leave your information with this podcast. Whoever wants to get in touch with you. Any final words?
No, other than thank you so much for having me today. It's been great talking to you. It always is. And for anybody that is considering, uh, it's a phone call. It's 15, 20 minutes. Grab a cup of coffee or a drink of choice and let's have a conversation. Uh, at the end of the day, it's 15 or 20 minutes that connecting with someone new, there's always an opportunity. And so I will leave with that. Thank you so much, Dr. Jiveh. I look forward to our next conversation.
It's been my pleasure, man. Thank you so much.
Okay.